this opportunity to present my doctoral work at this event. The title is The Journey of Foreign Educated Nurses Integrating into the American Healthcare Workforce. Many nurses from foreign countries immigrate to the United States, and there's a lot of hindrances to their integration into the workforce. Many stories are told by other people, but not by these foreign educated nurses. So I decided to pick this as something to be explored. So I use a metaphor of a journey. When you are in a journey, each journey is unique, no matter how frequent it is. You don't know where it's going to end. You don't know what will happen along the way. And I also use the metaphor of a package. When you get a gift, you have that, you're thinking what is going to be in it, So it's something that is very unique, that is it's not something that those nurses really know what they are into when they come to work in the United States. Background, there's global nursing shortages, and we're going to continue to have nursing shortages all over the world. There's also local nursing shortages in the United States. Also, I immigrated to the United States from Nigeria in the year 2001. I've learned a lot, and also personally and from other nurses who have immigrated to work in the United States. There's also a lot nurses could learn from their colleagues that immigrate to work in foreign countries, wherever we are from. The purpose of the study was to increase understanding among healthcare providers. It's important that we understand one another, especially those who are immigrating to work in the United States, because we're going to be working together. It has impact on organizations that these nurses work at, and then also we've been talking about caring since we started this conference. So we need to humanize healthcare services. We need to eliminate discrimination and advocate for a group of vulnerable healthcare workers. We need to promote smooth transition and integration of foreign educated nurses that are working and living in the United States. And of course, like I stated earlier, to fill the gap in literature about experiences of foreign educated nurses. Theoretical guidance, I use Margaret Newman, Health as Expanding Consciousness. Margaret Newman believes that meaning and health are found in one's ever-increasing capacity to understand and process information. Like I stated earlier, it's an evolving process. People make decisions to work in a foreign country, but they never know the impact of that decision in their lives and the lives of their loved ones. Consciousness is a manifestation of an evolving pattern of the whole. Expanded consciousness is about finding greater meaning in life, of becoming more of oneself, and of reaching new dimensions of connectedness with other people and the world. That's very important. The process, I had IRB approval to do the study, 10 foreign educated nurses. All Nigerians were interviewed, working in Minnesota, USA for about 10 to 11 years, all from the same recruiter except two male nurses and 8 female nurses, age from 38 years to 53 years, semi-structured structured conversations, and recording of responses. The purpose of coming to the United States. The purpose of these nurses coming to the United States was explored, their experience with recruitment and orientation, working and adapting to life in the United States, the social, legal, ethical, and economic ramifications of working in a foreign country. Purpose of coming to the United States. Some came to the United States because of marriage. They came to their spouse lives in the United States, or they got married. Their spouse came from the United States to their country to get married. They got married, and then they had to join their spouse. Encouragement of others. Some have relations, friends living in the United States, and they were encouraged to immigrate to the United States. Fascination with United States, maybe through movies or stories told, adventure, improved technology. Many have heard that there's a lot of technology in the United States that nurses can work with. Some came because they want good education for their children. They believe the United States is an advanced country, and some they just love to see the world. They love changes. So that's the purpose of them coming to the United States. Recruitment and orientation, it depends on okay. Recruitment and orientation, it depends on whosoever, how the people come to the United States. But this group of people that are interviewed had their situation is very unique. They were recruited by one recruiter to come and work in the United States. They paid the recruiter, and the recruiter also was paid by the institution. So the recruiter got paid double money for recruiting them. So there was a lot of legal problems that arose because of that, and also their experience with orientation was described by some as inadequate and by some as adequate. Adapting to work in the United States, they talked about culture shock, because the culture where they were coming from was different from the culture here. So there was a lot of culture shock. Many talked about discrimination in terms of work, that it's believed that their knowledge is kind of inferior to their counterpart in the United States. Many talks about communication. A lot of colleagues and patients feel they can't understand them when they talk. Technology, many have to work with equipment that they're not used to. Different ways of documentation and getting accepted, not only by their colleagues, but by patients and also other healthcare workers. So that led to the establishment of Nigerian Nurses Association in North America, so to be like a network forum for these nurses to talk about the problems and the challenges that they face, and how they can help one another to overcome those challenges. So social ramifications of immigrating into the United States to work. The social ramification. Many talked about the weather and then the interpersonal relationship in the United States, the individual versus community living, the legal ramifications that I've talked about that earlier. They were recruited to work actually for 2 years, according to the recruiter, but the recruiter also made arrangements with the recruiting organization for 1 year for them. So the second year, the recruiter can take another money from the organization, and then they have no flexibility about how many hours they can work and how they can work because of the being recruited, and also they were underpaid. So the ethical ramification, many of the values in the American culture, some of them are in contrast to the ethical values of these foreign educated nurses. Not also, apart from that, there's also a problem they have with the work values. You know, many are not used to the work system that they found themselves in the United States, like 1 nurse to 30 patients in the nursing home, and people having medications all the time, and it was a real difference from working in the hospital to being brought to the United States to work in the nursing home. There's also economic ramification. Many came because they felt that when they come to the United States, the economic situation would be better, but depending on who one talks to, many had their private practice in Nigeria. Many have their degrees in Nigeria before coming, and then they came to the United States. They had to start all over again. So they were not really sure whether there was any economic benefit to coming to the United States, but some did state that there is some economic benefit to working in the United States, depending on where they were working when they were outside the country. Like I stated earlier, it is important that we foster more positive relationship among nurses and among nurses wherever we come from. If we go out of this conference with this mind, then the purpose of this study would have been achieved. We need to help our fellow nurses who are struggling, who are new to the United States, to understand. We need to help them in their journey to integration into workforce in the United States. And also, of course, we have to understand ourselves before we can understand other people. We need to equip foreign nurses with truthful information. They need to make informed decisions about leaving home to practice in a foreign country. That's very, very important, because many nurses come to the United States without knowing what they are in for, and also to sensitize policymakers to complex and multiple ramifications of recruiting foreign educated nurses to work in the United States. This captures the purpose of foreign educated nurses coming to work in the United States. It says, one of them stated, "My vision is to go back to school. I want to be a doctorate degree holder and go back to my country and use the knowledge to help upcoming generations to update their knowledge of this profession." Thank you very much. Questions?